Hello and welcome to this session of the Early Childhood Voices 2022 conference. My name is Lisa Baker. I'm a PhD student with the University of Melbourne and also an early childhood educator of many years. I'd like to share with you my current research around wellbeing in early childhood education. Before we start, I'd like to acknowledge that beneath our homes, our offices, our education spaces and playgrounds are spaces that belong to the traditional owners of the land, wherever we're coming from today. This picture here on the screen is Lake Wendouree, which is where I live, and on Wadawurrung country, which you would recognise on a colonial map as Ballarat, Victoria, Australia. And I like to acknowledge the long and living relationship that the traditional owners have had with the land and the water and the sky, and my hope that we can work together to ensure that every child achieves their potential, succeeds in life and feels strong in their cultural identity. I'd also like to acknowledge my PhD supervisors, Professor Lindsay Oates, wellbeing scientist and researcher and Deputy Dean at the Melbourne Graduate School of Education, and also Professor Bridie Rabin, early childhood education researcher and author, also with the University of Melbourne. And finally, to acknowledge you, the people who are watching this conference, acknowledging that you bring with you a wealth of experience and knowledge and expertise, and that you will use that expertise to understand and to interpret all of the presentations that you are hearing today. So I'd like to start with a question. What is well-being? We talk about this concept of well-being a lot, but what does it really mean? I'd like to invite you to think about this just for a micro moment, either professionally or personally. What does well-being mean to you? If someone was to ask you to define or describe well-being, what would you say? And again, if you're an early childhood professional working with children, what documents or resources do you use or have you used to inform your theories and knowledge of well-being? And of course, the reason I ask this is because well-being is the focus of my research. So we're all working in a specific context, and the context of my research and anybody else who's researching in early childhood at the moment is this. We had in 1989 the United Nations Convention of the Rights of the Child, which is explicit that children have a right to access education and for the protection of their well-being. More recently, the 2030 Agenda for Sustainable Development has shared global goals for good health and well-being and quality education. It's also important to note, as much as we would like to forget it, that we do have the context of post-pandemic, which has been the greatest disruption to education in over a century, with impacts on well-being, and particularly for children, not only in the immediate term of their lives, but in untold ways for the rest of their lives. But prior to this and beyond, we do have an international backdrop of early childhood education increasingly focusing on well-being. Early childhood pedagogy and practice has undergone review in several countries in the last 20 years. In Australia, we have our own National Quality Framework and National Early Years Learning Framework, which has been established, putting wellbeing front of centre, particularly with outcome 3, children will have a strong sense of wellbeing. In other countries, for example, the US and the UK, have introduced frameworks that declare early learning must consider wellbeing content and outcomes. We also have contemporary pedagogical thinking, which tells us that early education should not only target traditional academic outcomes, such as traditional literacy and numeracy, and the processes of physical, social, emotional, and language and cognitive development, but also the facilitation of well-being, plus Indigenous ways of knowing and being, which have informed us about enduring protective factors for well-being. We also have neuroscience, specifically neuroscientific advances, which have added to what we understand is critical for children, not only from an academic standpoint, but from a wellbeing perspective and how that impacts the trajectory of their lives. On a political front, particularly in Australia, the Australian government's recent National Children's Mental Health and Wellbeing Strategy, it includes a key action of requiring all early childhood services to have a comprehensive wellbeing plan for children. And wellbeing science. Alongside us, but not necessarily in conversation with education, the field of wellbeing science has expanded in the last few decades to conceptualise and operationalise our understanding of human flourishing and of what well-being is beyond the deficit model of traditional psychology and mental illness. New theories have emerged from wellbeing science, including the meta-construct of wellbeing literacy. So this is where my focus is and where the context of my current study sits. Just briefly, I'm doing a PhD with the aim of exploring how wellbeing literacy can be utilised in early childhood. And the research that I'm going to speak to you about now specifically has the research question about how the concept of wellbeing is defined, described and used in early childhood education in Australia. So I've been asking what is wellbeing in early education and have conducted a content analysis of documents in the National Quality Framework of Australia. So the data set has been from the Australian Children's Education and Care Quality Authority, ACEQA, and other influential documents. Inclusion and exclusion criteria came from adapting Cardno and asking questions around each document's purpose and location, authorship and intended audience, context and intended use, text and consequences. So, for example, looking at a document, I asked, does this document inform or impact early childhood pedagogy or practice? Does this document have a wellbeing implication or content? The final documents that were included were ones that were subjectively qualified as both everyday documents in early childhood and also ones that had a big impact on our work. The method was a qualitative summative content analysis, so conducted on the selected documents to assess the way that wellbeing is conceptualised. More about this methodological choice can be found in the final paper. But the steps were a manifest content analysis and then condensation of text around explicit mentions of wellbeing. Categories were formed and applied, and then a latent content analysis for interpretation of how each document described or used the word wellbeing, and then a derivation of themes to express the underlying meaning and usage of the word wellbeing in each of the documents. So just to give you a quick overview of the data set, the final selected documents, Australian documents, as I said, national law and regulations and pedagogical guides and regulations, also the United Nations Convention of the Rights of the Child, and then some information sheets from the ACEQA website. So there were multiple categories that were derived from the content analysis. So many categories around this concept of wellbeing. And just to give you an idea, these are some of the words that came up around uses and definitions and descriptions of wellbeing. So broadly, things around hygiene, sleep, toileting, to other areas of risk, safety, health and protection, and then other areas around psychological constructs of satisfaction and resilience, connectedness, and then other areas around learning, development and outcomes. So a really broad amount of categories were revealed from the documents. Through the qualitative summative content analysis, there were 13 themes around wellbeing that were identified in this document landscape. And you can see, I hope, a bit in this table, how these themes manifest in different documents with, for example, themes of risk, safety, health and hygiene clustering around the top there in those top level documents, such as the law and the regulation, whereas themes around learning and development, plus more psychological constructs around wellbeing, for example, resilience, were more prevalent in the pedagogical documents and guides. So you can see for early childhood educators, teachers, professionals working in this document landscape, there's a really broad and disparate themes around wellbeing that were revealed. So very briefly, some of the findings and questions that I have from the paper that is in preparation at the moment is that usage of the term wellbeing is disparate and multifold. I think just very briefly in those last couple of slides I shared with you, you can see that for yourself. There isn't a unique or narrow conceptualisation of wellbeing. It is really broad. Also, interestingly, that definitions of the term wellbeing were rare. There was only one across all of the documents, and that they did lack contemporary perspectives. And I do have one enduring question about what implications are there for early childhood professionals when wellbeing is viewed as a learning outcome. So just for a moment to dip into the idea, the finding that definitions of wellbeing were rare and lacking contemporary perspectives. There was only one description of wellbeing offered across all of the documents, which for those of us working in Australia, you will recognise as this description here. It's perhaps more a list of phenomena than a definition of wellbeing. But the thing that I found particularly interesting was that this description, a glossary term of wellbeing, has been adapted from Lavers in 1994. So this Lavers description is derived from a paper that was presented at a conference on early childhood education in Belgium in 1991. And given our contemporary context of listening to voices in 2022, and the context that I discussed at the start, I'm just wondering how relevant or accurate or sound for policy and pedagogical practice is the basis of this wellbeing glossary term. What gaps exist? What contemporary theories and contemporary conceptualisations of wellbeing are not being privileged in our current documents? And I'm just wondering how this impacts how educators are seeing and using ideas of wellbeing. As I said, I'm also finding a lack of contemporary wellbeing science perspectives. We've had neuroscientific theoretical and pedagogical shifts in the recent decades, and again, a vast growth in wellbeing science research that can be applied to early childhood pedagogy and practice. Wellbeing literacy is a really relevant and contemporary literacy in early childhood education, I argue. And I think we can have some further research and collaboration between early childhood and wellbeing science. So wellbeing literacy, very briefly, is the mindful use of language for and about wellbeing. And I think it's a relevant literacy in early childhood education. Finally, implications for families and early childhood education professionals. I think the idea of conceptualising wellbeing as a literacy, as opposed to that broad and disparate conceptualisation we're having at the moment, is a way that we can think about children and wellbeing in a different way. It also accesses contemporary wellbeing interventions and literacies in early childhood education when we can dip into wellbeing science. And I think wellbeing literacy can support child and family communication as they're developing knowledge and skills and language around wellbeing. And I think that early childhood education deserves multidisciplinary informed pedagogy and practice. If you'd like to read any more about my recent publication on wellbeing literacy in early childhood, you can scan the QR code there. And if you'd like to know about this paper that's being written at the moment, you can scan there as well, and I'll be able to send it to you. So finally, thank you. I hope we can all keep looking forward in early childhood education and share all of our voices for the betterment of children and early childhood education. Thank you so much.